What's up, people? Hailtothebreak here. Welcome back to Let's Play Transistor New Blood.
The results from the liver exam indicate that the patient has been making satisfactory progress. She seems to be recovering well, but it's unclear how this disease was transmitted in the first place. We should continue monitoring her for at least another month.
I see. Well, I think it's safe to say that the treatment was successful. How about the pathogen itself? What have we learned? And please, keep it brief, Robert.
My pleasure, although our analysis is only partially complete. First, the biopsy. Stigma did not match any known organism, meaning it's a new species, so we'll have to come up with a name for it. So how about it, Dr. Everett? You'll be a grandfather one of these days.
Well, my son's only 12. All he thinks about is football.
Oh, well, in that case, I'll ask someone else. Now, regarding the spectral analysis, our attempts to determine its structure resulted in failure.
What? How is that possible? I've never heard of that happening before.
We tried a different machine, but the outcome was the same. We screened for nucleic acid, proteins, glucose, lipids, and ATP, but there were no matches. Stigma consists of an organic compound that is completely foreign to us.
What? This will change the way we think about life itself.
Whoever is credited with its discovery will surely make history. From a medical perspective, it's fortunate that Stigma's infectivity is weak. We're trying to culture it, but so far there's no sign of growth or multiplication. It's going to be difficult to determine the means of infection as well.
This is more serious than we thought.
Madam Director, we have an emergency. Leslie, we're in the middle of an important conference. Deputy Secretary Marshall has collapsed. He may have intraaxial hemorrhaging.
George Marshall, from the Department of Homeland Security?
As always, folks, someone's gonna get hurt.
All right, let's adjourn the conference. Leslie, I want you to prep operating room 3 for him. Vaughn, Blaylock, you two will be performing the procedure.
You want us to operate on a high-ranking government official?
I'll explain the details before the operation, so please go make the necessary preparations.
It's been 35 minutes since he collapsed. He's a 9 on the coma scale with mild tachypnea.
We're waiting on the CAT scan results, but it's most likely a case of subarachnoid hemorrhage.
This is his chart from his previous admittance. We performed deep brain stimulation to treat his dystonia.
And he was able to recover from that. Incredible. Looks like the system's produced by Columba and Cornix, the same company that made Elena's pump.
Yes, it's now a subsidiary of Humani. If you have any questions about it, you can ask Isabella.
Director, what's this shadow here on the X-ray?
Oh, that. It's a hippocampus chip. We implanted it at his request.
He didn't want to forget anything, so he opted to have his memory augmented. I assume they're keeping it quiet. Do we need to worry about being in violation of state law?
We don't have time to discuss that. Now, the hematoma is far enough away from the electrodes, but take care when using the thrombolytic.
Okay, we'll head over to the OR then.
It would be so nice to have stuff like that in real life. I mean, being able to cure pretty much anything and have a bunch of implants and crap like that get augmented. Kinda sounds like the plot of the IX, by the way. Anyhow.
These are the results from the CT. Please take a look. A number of aneurysms have been detected. Some of the blood vessels have already burst and are hemorrhaging heavily inside the brain. First, we must clear the excess blood from the area. Then, remember, this is brain surgery. Please be extra careful when performing this operation.
Even a tiny mistake could debilitate his brain. We better be careful.
This will require extreme delicacy and dexterity. We need to do our best.
Yay! Let's make the guy a vegetable. No, I'm kidding.
Alright, let's begin.
Someone's gonna have to tip me out on this one. Because I know for a fact, in my own language, when we call someone a vegetable, it's someone got a
Since we're operating on the brain, even the smallest mistake can be fatal.
brain
We'll
problem
have
where
to
you
be
cannot really
extremely
think
careful.
and just being there. No, the English uses the same meaning for that word
That
too.
bulge on the vein is the brain aneurysm. Let's remove it before it bursts.
I'm getting the sedative ready. Please, let's detach it with the scalpel. The aneurysm has been detached. Please
This
place it
mission you
until
gotta
the
be quick,
aneurysm
because
has
they
been
will,
removed.
basically, it's
Please
better
hold
to
the
let
vein
them
with the
bleed like that
forceps. The vein has
at
been
some point, because
reconnected.
if
Please
you're not fast enough,
reattach
there's gonna be a shitload of them. It's better to remove them before they burst rather than, or just put sedative on
The
them.
test said there were multiple aneurysms.
There's a chance that any of these vessels will turn into aneurysms. Have the magnification. Let's shift our viewpoint.
Yep, you heard right, folks.
There it is. Let's treat it before it bursts.
Come on.
There's more
let me
where we're
move.
not. Once we treat the ones in sight, we have to quickly change our focus.
Again, the best thing here is to freeze them all and just make them temporarily unable to actually do anything or damage
The
anything.
sedative's effect has worn off.
Because
Please inject it again.
if you just
Vitals are dropping.
let them do their thing little bit too much by their own, you will get serious amount of damage undone. So I say prevent them from doing any damage, and after that deal with them. Oh, and also deal with the bigger ones first, because the bigger ones mean they're gonna burst a lot sooner than you expect. Come on. That's one thing with the magnification glass tool. You gotta be careful. If you're a little bit off your target,
It's hemorrhaging. The blood needs to be drained.
you
Vitals are dropping.
won't be able to actually do anything, because for some reason the game won't allow you to actually pick up stuff if you're a bit too far. Come on. Let's freeze those two.
Doctor, please
Crap.
inject it into the bulging vein.
You're gonna notice sometimes I miss it because I don't even look at what I'm doing, because I try to do it by peripheral vision, which is not always a bright thing to do. Peripheral vision is usually reliable in a bunch of
Vitals are dropping.
circumstances, but not always. If you guys have been
Looks
playing
like the
FPS,
situation's
peripheral vision
calmed
is a pretty
down
good
for
thing to
now.
have.
But his vitals aren't. Let's wait a moment and see what
Well,
happens.
pretty much everybody got peripheral vision, but, you know.
Doctor, please hurry. If all of these burst at once.
Yeah, I know, since I def. But yeah, peripheral vision is pretty decent skill to have. Well, it's not really a skill, everybody has it, like I said, but some people get a better one.
An
Actually,
aneurysm seems to have burst outside of our current view. Use the magnification
Bitch.
tool to find it.
that stuff. There was probably a fourth one that no! That one's gonna burst.
Vitals are dropping.
That one's gonna burst pretty well. Oh, by the way, if you when they get caught, your vitals gonna start dropping really fast. So don't leave those things like that for too long, because they will do serious amount of damage on you. Like pretty much everything in this game. There's probably ways to be more efficient at this than that, but fortunately for you guys, I don't know how to be more efficient than that. Playing this game reminds me I should probably go and buy the third one. The third one is a bit less focused on surgery, more than it's a bit of a mixed bag of different things really. There's forensic and a bunch of stuff like that. Still in the good old trauma center fashion though. Seen the let's play of it. It seems pretty decent.
His vitals are stabilized. We're done here. Excellent work.
Yep. Could have been much better.
Columba and Cornix's brain electrodes and pump units may seem cutting edge, but it won't be long before they're made available to the general public. Just like the pacemaker. Professor Wilkins had one. Why do I have this nagging feeling? Everyone who's contracted stigma has had some kind of artificial agent in their body. Even that one patient who was transferred here had Syntex Q heme blood. I was using artificial blood with my test mouse, too. I wonder if there's a connection.
Dr. Vaughn, can I trouble you for a moment?
Of course.
I wanted to check on the Deputy Secretary's condition.
I doubt I can tell you more than you already know, ma'am. Since he was brought here promptly, cerebral ischemia was kept to a minimum. And there are no signs of severe paralysis, so we shouldn't have to worry about any after effects. We can't use the MRI, so we'll take another CAT scan tomorrow. Will you be advising on his rehab, ma'am?
Yes, I will. I also need to administer a personality test. Because of his implant, he must be closely monitored. It's sad, really. He's such a talented man.
Yeah, I feel sorry for the guy. But I'd like to leave him in the hands of the others so I can concentrate on stigma.
Agreed. And Dr. Vaughn, it's a shame that you feel the need to keep secrets from us. But I'm hoping that will change.
What makes you say that?
Your cutaneous muscles seem a little more tense than normal. I'm out of practice when it comes to reading faces. Was my assessment accurate? You're a critical part of the Caduceus team. I hope you're not thinking of leaving.
Of course not.
Challenge. Oh, chapter 4. Wasn't really expecting that. Hold on a minute, folks. I gotta check on something. Okay, let's do this.
Hey! You there! Do you work here?
Who? Me? Well, yes.
Could you please take a look at my son? He's been complaining of terrible stomach pain.
You brought him here? We don't accept emergencies or walk-ins.
I heard this hospital is famous. And it's so big. There must be someone who can help.
Well, there's no point arguing about it. I'll take a look at him. What's your son's name?
Oliver. Oliver McHale.
You wouldn't believe the patient I'm dealing with. He's throwing a fit because his operation isn't expensive enough.
Are you serious?
Yeah, his friend just had a hernia operation that cost $40,000, and he doesn't want to be outdone. He's 11 years old and filling the role of a trust fund brat perfectly. I guess it wasn't enough for him that his father pulled some strings to get him into this place. He's the son of some big shot, and neither of his parents have the time to bring him here.
So how much are we charging him?
About $30,000. The operation will be performed in a deluxe suite. Not bad for a case of appendicitis, huh?
Appendicitis? What a coincidence. I'm seeing a boy with the same condition.
Excuse me, Dr. Blaylock?
Yes, Elena?
I have a message from accounting. They say to transport your new patient somewhere. It seems the family can't afford the treatment. Since Caduceus isn't normally open to the public, they don't know how to deal with situations like this.
How much is it going to cost?
Well, the family doesn't have health insurance, so at least $10,000.
But transporting him now will put his life at risk.
Unfortunately, money talks. Even when it comes to healthcare.
What do you think? Should I have him transferred?
That's a tough decision. Marcus, have you given your patient his bill yet?
No, why?
Do you mind if I handle it?
Looks like someone's got a plan.
Chandler, I mean, Mr. Forbes, about your hospital bill. The total will be $30,000.
I told you, that's not enough. I can't lose to someone like Jimmy. His dad's just the president of some little company. I want a premium upgrade. Bring in like 10 doctors.
I'm afraid we can't do that. But there might be something else we can do. If you'd like to make a donation, we can increase your bill. How does $10,000 sound?
That's it? Well, how much would the total be?
That would bring it up to $40,000.
Seriously, kid, you don't know how to count if you actually asked that.
But that's the same as Jimmy's. That's still not high enough. I'm way richer than he is.
Well, we could add 2,000 more and make it 42,000.
42,000. Well, I guess that's okay.
I wish I had that kind of cash.
My daddy gives me whatever I... Oh! Ow! My tummy hurts. Hurry up and fix it!
We have the best room reserved for you, so let's get started.
Well then, the donation will be transferred from the hospital to the Oliver McHale Fund.
Nice thinking, Val.
Elena, prep for surgery. We've got 2 appendixes to remove.
Pretty sneaky, Val. To be honest, I'm impressed.
It still counts as a donation, so it's not gonna cause us any problems, right?
It'll be fine. It's in both their best interests anyway, so it all works out.
Well, let's begin the conference. The first patient, Chandler, has acute appendicitis. It appears to be in its early stages, so the operation should be fairly routine. However, the second patient, Oliver, seems to have the same condition, but in an advanced state. It looks like he's been trying to hide his symptoms.
But he's only a child.
We understand the situation. This is going to be 2 operations back to back, so let's be quick.
So yes, I was wrong. This is one of those. As
We're
you
going
get
to
more
save
than one
them
patient.
both, of course. Let's get started.
Talking again, I just remembered something.
This boy's condition.
It's still too late to treat it with antibiotics. It would be best to perform it.
All right. Please begin the procedure.
Basically, in Trauma Center, the other one, Trauma Team, which is the third one in this here in the franchise. This one's the second one. You can,
Please prepare to extract the appendix. First,
there is
inject
the
sedative. Next,
a little
we'll be cutting into the messy
thing that's
appendix.
called
Use
emergency,
the
which is
scalpel
basically
to
like
next.
a bunch of
We'll tie
person
2
back to back.
wires around the appendix. However, they must be tied in the appropriate.
One goes around the base of. Look at where the wire needs to be. Then slide it down while pressing. We're done tying the base. Now for the wire around the appendix.
Okay, forceps. No, click on it.
Now that both
Got
parts
it.
make an incision between. Now that the appendix has been severed, please place the appendix.
Get up.
Fix the
Stuff and
member
gel. Okay,
that
now I
looks
remember.
like our first operation.
This one's gonna be a bit of a bitch though, if
Let's
I'm right.
close him up.
Oh well.
That
Let's move on to our...
Doctor, we have a problem. Oliver's condition has.
What?
Ooh.
what's his condition?
He complained of severe pain.
Don't tell me. His appendix has burst.
We'll find out when we open
Yep.
him up. We have to hurry and get in there.
Beforehand, let's get the vital a bit back up. There's no point in being a jackass in this one.
The pus is causing inflammation.
It's peritonitis.
Treat the inflammation and drain the pus. The appendix needs to be removed as well. Begin with the sedative.
Okay.
This is bad. The appendix is festering.
See, that's what I meant when sometimes this game is a bit annoying when there is a pool of liquids that miraculously block the thing you're actually seeing. Just like that. The detection on this game is not perfect. It's probably the only thing I would really complain about. Come on. Thank you. Let's get that, let's get that.
Please hurry up and extract the appendix.
Again.
Secreting pus.
Let's get that. Come on. Thank you. And get that again. Get this. Drain the thing. Get that. Whoa, that's a lot of stuff.
The appendix has been fixed. The synthetic membrane has
Go.
been affixed. Let's treat the remaining
We're gonna play some
wounds.
tap on this one. Information on this one.
The
Well, in this game,
appendectomy
really,
is
it's just
complete and the
Just think of
peritonitis
pressing
has
a
been
J
treated.
button all the time, a bunch of times, just trying to get a
Let's
little
close
dust.
him up. This boy is very. If he'd waited any longer, well, let's close him up.
If you wonder, for a game like that, there's about 2 buttons you really need. You like use left thumbstick to select your thing, and pretty much A, and sometimes B for certain things, and sometimes C if you want to use the touch at
Rich
some
or
point.
poor, we're all the same under the knife.
Little name drop here.
Never thought such a simple operation could put me on edge like this.
Because Under the Knife is actually the name of the DS version of this game.
I think we've all learned something from this operation.
Thank you so much, Doctor. You saved my son's life. But I thought that this hospital didn't treat normal patients.
Well, it was an emergency, so this was a special case. Thankfully, an anonymous donor paid for your treatment fees.
I can't believe how fortunate we are. That donor must be an angel.
Or a brat.
Yes, well, please see to getting your son health insurance so he can get the medical help he needs.
Okay, I will. Thanks again.
You're welcome. Take care now.
You're very good with children, Dr. Blaylock.
Thanks. I did some volunteer work at an orphanage. How about you, Marcus? Who are the lucky beneficiaries of your time?
I didn't do any volunteer work.
Really? I thought that was a requirement for all doctors.
Anyhow, folks, that's pretty much it for today. So, was Hailtothebreak here? Talk to you all later. See ya, guys.